You come back on the first of March.
All right. Yeah, I have no idea.
I have no idea.
I have no idea.
I'll
Look
find
in the
out when
white
they
book.
tell us. Don't come on.
Look in that white book that we gave you, and it will tell you. The one other thing, just to put a bug in your ear, so we will be having you guys are not going to be newbies in 3 weeks. That's ridiculous to me.
Yeah.
You guys are not newbies after 3 weeks.
Now we can look at the new ones like,
We're gonna be sophomores.
No, you're going to be so sweet to them.
yes.
And they're adorable because you're going to get to see a little glimpse into your past. Because you're going to see all of these newbies with their jeans and their t-shirts, carrying their papers and their brand new shiny backpacks doing this.
Is that how we look?
That's exactly how you look. So you're going to be making fun because you guys are now the old
I feel like I
leather
look cooler
sailors.
than that.
And that's exactly what you looked like. You're just
I
with
feel
your
like
little
it's
backpacks.
gonna be so embarrassing to see those people because we're gonna be like, ha, look at them, and then we're gonna be like,
So since we were the Onyx with the last graduating, so what are the next ones coming in?
Rubies.
Rubies.
Yeah, it's always, so the seniors are rubies. They are going to externship. And then the new group coming in will always take over that new color.
Okay,
So then when the sterlings go out, the new group coming in
So our
November will be the
so
sterlings.
our Onyx that we had were the last seniors that graduated. That's why we're Onyx now.
Yeah, the last group that just left were the Onyx.
Okay,
the people that are here that are Onyx, are those people who like failed a class and they started with a different class?
Not necessarily. We did have some, so we're having to make a lot of, everything is fluid and liquid right now because of COVID.
Right.
And so I know that we had a few Onyx from the graduating class that ended up having to be quarantined. So they missed the surgical rotation because if I can't really Zoom you doing surgery.
right.
That doesn't really work. It's like, okay, open them up on your kitchen table now. So it doesn't really work. So because they were quarantined, we were able to carry them through and make sure that they got their surgical rotation, because that's what you need to finish the class, and that's required to do your externship.
Yeah.
So that's what probably happened, was that they were the ones that had to be quarantined throughout their surgical rotation.
You start that your senior year or junior year?
Senior,
Senior.
yeah, your very last semester here
Is surgery.
is surgery and anesthesia. And then you also do the farm. You go and do your large animal practicum with Dr. Mendoza
That's what I'm
and a
ready
VTNE prep class.
for. They were down there yesterday in their cowboy boots.
Uh-huh, yep. Just boots. They don't have to be cowboy boots.
Oh, they're gonna be cowboy boots.
Yeah. I got like some there now.
All right, so today we're going to continue on with our minerals. We've gone through phosphorus and calcium, which have very similar functions as far as bone and teeth formation. We know that they also both help with metabolization of energy producing nutrients. They both help with reproduction. And then calcium had kind of the little added bonuses of helping blood clot and being nerve transmission. We went over the deficiencies and the excesses. And now we're into potassium, which happens to be my favorite nutrient. I talked to you a little bit about the perfect murder. Not really worried about any of you performing it because there's math involved.
You didn't tell us how to do it for us math with this, I'm not that good.
So potassium, the chemical symbol is K. Why is it not P?
Because phosphorus took it.
Because phosphorus already took it, cheeky monkey. Potassium aids in muscle contraction and nerve transmission. Those are the two biggies. Put two little stars beside those. And this is what affects you when you have a Charlie horse. If you are low in potassium, your nerves misfire, your muscles contract when they're not supposed to, and you end up with that horrific Charlie horse, usually about 3 o'clock in the morning. They're horrible. Has anyone never had a Charlie horse? Really?
Good.
I'm in shock right now.
Holy smokes, you guys are so lucky, because the worst thing on the planet, oh my gosh, you guys.
It's when you're asleep and it happens.
Well, number one, when you're asleep, or the even worse thing is when you move weird and you can feel that it's just starting to
Yes,
go.
and you're trying to stop it.
and you're like,
trying to stop it.
That happened to me when I was pregnant. It would happen often. Like I would feel myself stretching, and then as soon as I was stretched, I would start feeling coming up. Like,
And you feel it and you feel it
toes
start
in by
to go.
themselves.
yes, but I was like
And you can't
super bad,
stretch
and
when
I'm
you're
like,
pregnant.
wait, yeah.
I start walking on my tippy toes and trying to
It's
stretch out my muscles.
awful. Potassium is also going to help with the movement of fluid, which is osmotic, remember from a million years ago, or osmotic pressure. And then obviously, just like all the others, it's going to help us metabolize our energy producing nutrients. So what happens if we don't have enough? We're going to have the decreased growth, again, across the board, because even though these minerals are not actively producing nutrients, they are helping our bodies use the nutrients that we have, which is also going to give us lethargy. Well, if your muscles are involved, I mean, when you think potassium, immediately think Charlie horse. Well, are you doing a marathon with a Charlie horse? No, you're laying on the ground, leaping, punching your leg. You are. Why is that our immediate response? Is to just start punching it.
I don't know. I'm trying to get rid of it.
It works.
So you're going to have some locomotive problems. If your nerves aren't firing and your muscles aren't contracting normally, you're not going to be able to move normally. Hypokalemia. Let's break that down. Hypo. Low. What do you think cal might mean?
Potassium.
Potassium. Emia in the blood. Yeah. Low potassium in the blood. Potassium is also going to affect your heart and kidneys, specifically your heart. Well, that kind of makes sense because if nerve transmission and muscle contraction are affected by potassium, we're not just talking about your skeletal voluntary muscles. Your smooth muscle and your cardiac muscle are also involved. So you're going to end up with lesions and cardiac issues, and then you're going to have weight loss, emaciation. One of the common clinical signs, if I ever ask you at any point in time, tell me a clinical sign of a deficiency of blah, blah, blah. It doesn't even matter what mineral. If I say deficiency, the one thing you can very confidently, everyone's going to get this point on the test. Anorexia. You can just pump your little fists in the air and go, anorexia.
I was gonna say weight loss, but that, I mean.
Well, anorexia would then lead to weight loss, wouldn't it? But anorexia, we're going to have that hungry switch turned off. And so pretty much there's only one exception to this rule, which we will get to. Every other mineral deficiency, anorexia. Yeah, so anorexia by definition just means you're not eating.
You got full freedom most of the time, right?
And you might have to force feed them, you might have to tube feed them. I had some, did you have a? But you forgot, okay, well, let me know if you remember.
Like if it's just a random, like, that's what I remember, okay.
Well, say it now.
I lost
And she lost it again.
it. Something about, yeah, like, okay, there we go, found it.
Okay, guns on the wheel.
Yes, so, like, basically, in every single deficiency, like, that has, like, that includes this, you're gonna see anorexia.
Pretty much,
Okay.
pretty much. I don't like to say every, because there
No.
are a few exceptions to the rule.
Yeah,
The majority,
okay,
you're gonna see anorexia.
all right.
Potassium excess is pretty rare. You can't really overdose yourself on bananas. Okay, you can't really eat enough bananas to overdose yourself,
I like to eat bananas with special K, chopped up.
right?
Cornflakes, they're really good.
Absolutely. Mm-hmm. I like banana bread.
Oh, yes, and a smoothie.
Mhm.
Miss Honey, y'all making me.
I don't know that.
Y'all always do this.
Always make me hungry.
Why are we talking about the food right now?
Because we're talking about bananas. All right, so, but if you did eat enough bananas, you get like a crate of bananas and you're like, screw you, Huff, I'll show you. I can eat enough potassium to overdose myself. Two of the things that are going to happen is paresis. And what paresis is an incomplete paralysis. And it's usually going to happen on one side. An example of this, have any of you heard of the term Bell's palsy?
I was about to say that, yeah.
Bell's palsy would be a type of paresis, which is an incomplete paralysis. You have some movement, but the muscle and the nerves
So
are
it's like a
affected.
partial- it's like a partial paralysis?
Saggy and stuff,
Yeah,
right?
I have Bell's palsy. Of course I have Bell's palsy. Why would I not? But I do have Bell's palsy. It's not noticeable because of my glasses, but the left side of my face has Bell's palsy. And when I am tired,
It gets worse.
my eyelid
Droop.
Yeah,
droops. And so there are some days where I'm just droop and I have to like lift it up out of my way. So my one, if you can see my left eye is a little more hooded and droopy today than my right. Back when it was in full, I had no wrinkles. My whole forehead was paralyzed. So when I would do surprised face, this would be completely smooth. I would have no wrinkles here, only this side would go
Oh,
surprised.
wow.
And my cheek was droopy. So I did.
Is that like a neurological thing too?
Uh-huh.
Okay.
Yep, absolutely. Doesn't have to be. I did not eat a crate of bananas and give myself Bell's palsy. Mine was a neurological, immunological, secondary to the West Nile virus. And then,
And so does
So
it
then
affect primates the same way since that's part of their diet?
do what? I'm sorry, I got too many people
Okay.
talking at once.
I was asking, so does bananas affect the primates the same way since that's basically
The
their diet?
bananas, their normal diet is not bananas. I know we're like, oh, monkeys like bananas. No, when the apes are in the jungle, they're carnivores.
They're carnivores, right?
Yeah, they don't sustain themselves
They live
primarily
on-
on bananas. So, but you gotta remember, any diet that an animal is supposed to sustain themselves on, physiologically, they are adapted to do that. So if you are a brand new species on the planet and you're only meant to eat bananas,
Are they strictly carnivorous or are they
some
omnivorous?
some
Because
are
some of them
omnivorous,
aren't.
some are vegetarian.
Right,
Yeah.
okay, yeah.
The other thing that's gonna happen with your potassium excess is the bradycardia, which is gonna be a slow heart rate. And that was what was involved with the perfect murder, where we slow the heart down and then the body trying to speed the heart up dumps more potassium into the blood, which in fact ends up killing your victim. And yeah, don't. And an elevated potassium on a tox screen of a heart attack victim is not abnormal. So you're gonna get away with it.
Awesome.
So what is the?
So you recorded this.
No, because I already made my disclaimer.
How much do I?
I already made my disclaimer. This next one is actually two minerals, but we very often refer to them as a singular. But it is important to note that these are two separate molecules bonded together. They are ionically bonded. So sodium and chloride, one donates an electron to the other, and that changes the charges, opposites attract. Chloride can bond with a whole bunch of stuff because chloride only needs one in the outer shell. He's already got 7 in the outer shell. And so he's just happy to receive one from anyone. So you'll see him bonding with zinc, hydrogen,
around.
sodium. He does get around, but in this case it's sodium chloride. Sodium chloride happens to be one of the more common IV fluid therapies that we use of various percentages. We have a 9%, an 11%, a 15% sodium chloride. Just a little tech tip from me to you. When your doctor is requesting you to set up an IV bag of sodium chloride 9%, they're not going to say sodium chloride, they're going to call it NaCl. So if they're like, hey, I need you to go get me a liter of NaCl, that's what they're talking about, sodium chloride. So what does all of this do? One, sodium chloride is salt. Sodium is super important for nerve transmission. Without sodium, your nerves do not send messages. In fact, sodium and potassium are the two molecules that are involved in your nerves sending a message. When you guys get to the neural system, are you guys still doing digestive?
Yes.
We just finished urinary.
Oh my gosh, I love the kidneys. The kidneys are fabulous. What are you shaking your head for? My
It's
gosh.
my least favorite.
Yeah,
one.
mine
They are gorgeous. The nephron is amazing.
I like that one.
It's figuring
The
out the
nephron is-
absorption and it's just a little cycle that goes through this kind
I
of.
love it. It goes down into the medulla. You have the loop of Henle. Oh my gosh, it's fabulous. I love it. When you get into the neural system, though, you're going to learn about, and anybody in here ever taken a biology class, sodium potassium pump? Yeah, you're going to learn all about the sodium potassium pump, which depolarizes and then repolarizes the neurons. And depolarize and repolarize is a term you learned in cardiovascular, which means to alter the charges. We turn it from positive to negative and then back. And this change in charges is what transmits the impulse. Well, we've got sodium on the outside of our cell and potassium on the inside. And what happens through magic, you'll learn the real stuff, is that all of the sodium floods to the inside of the cell. And all of the potassium floods to the outside of the cell, and it changes the charges. And so it's the change of charge, but what has to happen first? The movement of sodium. If you don't have sodium, it doesn't move, and the nerve does not transmit the message. So sodium is super important for your nervous system to properly work. Sodium chloride also helps maintain your fluid. You guys just learned about the nephron. The medulla, or the inside of your kidney, is super, super salty. That's how your kidneys work. Your kidney's main job is to figure out what do we need to keep and what do we need to get rid of. Spoiler alert, it keeps almost everything. 99% of everything that goes through your kidneys is retained by your body. Well, one of the big things that our body is set up to hang on to is water. So what happens is the medulla of your kidney, super salty. The environment, the tissue is super, super, super salty. And so what happens is, as the loop of Henle goes down into the medulla, I anthropomorphize everything. The kidney, the nephron is looking around going, oh my God, look how salty everything is in here. We don't want this to be salty. We should try and dilute this out with water. And so it starts throwing water into the tissue to try and dilute out the salt. But then there's a cheeky monkey part, because in the ascending loop of Henle, it's throwing salt back into the environment. And that's how we regulate. Depending on what your body needs, it will throw the salt so that you retain the water. And if you don't need to retain water, if you're overhydrated, guess what? It doesn't throw as much salt out there, and it's not as salty an environment. And if you're super dehydrated, it throws all of the salt, and you keep hanging on to all of the liquid, and you don't get rid of any of it. It all goes back into circulation. So that's salt and how it reacts and works with your kidneys. And that's how the loop of Henle works, and your collecting ducts. You've got two areas in the nephron that dip down into the medulla and retain water. This is also why this fluid retention is also why people with high blood pressure have to go on a salt-restricted diet. Because if their blood pressure is already high, do I really want to be adding a ton of fluid to their blood? No, what's that going to do to their blood pressure? Make it go even higher. And so we're going to be on a salt-restricted diet. You're also going to see salt-restricted diet in animals with kidney disease, because we want the kidneys to have an easier time. So that's kind of a really nice example of how nutrition and one of your other classes, anatomy, buddy up, and they directly relate with each other. Did everyone follow me on the whole nephron thing? Everyone's okay with that? Oh, the nephron is amazing. I love the nephron. am deficient in salt, if I am deficient in sodium chloride, I can't regulate my water. Well, that makes sense. If I can't make that environment super salty, my kidneys are not going to dilute it out. I'm not going to retain the water. I'm going to be losing massive amounts of water, and I'm going to get dehydrated. Decreased growth, there's our, if I say deficiency, you can confidently say, and that was pitiful.
Yeah.
Thank you. One more time. When I say deficiency.
Anorexia.
Thank you. Fatigue and hair loss, and those will be directly related to the inability to use your energy producing nutrients. I'll give you guys a minute. Everyone okay with that? Any comments, questions, concerns so far? Pretty common sensey so far.
So basically everything causes pretty much anorexia.
There's one exception to the rule. There's one exception to that rule,
Okay.
and we'll get there.
Okay.
But pretty
But I have
much
noticed pretty much everything is
on the
anorexia.
test, if I ask what is a common clinical sign among most of the minerals,
Anorexia.
I am. So the reason why sodium chloride solution is one of the most common IV solutions is why am I giving an animal IV fluids?
They're dehydrated.
Because they're dehydrated.
You want to try to get it
And
into them.
I want, so dehydrated animal, my goal is to have them retain as much fluids as we possibly can get them to retain. Well, what by definition is going to do that? Salt. So if I give them a salt solution, a sodium chloride solution, that in itself is going to cause them to hang on to more fluids. If I am increasing the environment in the kidneys, I'm increasing the salt in the kidneys, I'm pulling more water out and I'm not urinating. If I'm increasing the sodium chloride in the blood, guess what? Your body looks around and goes, oh my God, where is all this salt coming from? Let's dilute it out. It doesn't want it to be a salty environment. It dilutes it out by hanging on to water and retaining water. And that's why we use sodium chloride as a IV fluid for combating dehydration.
Well, the same thing as saline.
Saline is not, but saline is, so there are other types of IV fluids. You guys are going to get into all of those in clinical pathology next semester. Remember a million years ago when we were talking about solutions, mixtures, and colloids?
Yeah.
Those are all types of IV fluids. This would be a mixture. We also have things like colloids, which have very large particles, like plasma expanders. So if you have an animal in shock, you need to increase the blood pressure very quickly. You go ahead and give them a colloid, which will increase the blood pressure. And so you'll learn all about those. We've got lactated ringer solution,
Yeah,
glucose
okay.
solution.
That's what
You'll
they
learn-
do when I'm pregnant, like you're learning.
You'll learn about your dilution rates. Yeah, you'll get all of that in clinical pathology. But this is just nice because you guys have already done the kidneys, and so I can relate this to dehydration. If I have too much sodium chloride, you are going to have this series of clinical signs. First, you're going to get thirsty. That makes sense. What happens when you eat McDonald's French fries?
Get thirsty.
You get thirsty.
Salt makes you thirsty.
So now I have too much salt. Let's critically think this through. You got to really start to get that analogy in your head. So my body is super, super salty and it automatically wants to dilute out the salt. The problem is that I can't take in enough fluids to do that. So my body just starts finding fluid wherever it can, sucking it out, diluting the salt. So I have a lot of water in my tissue. So it starts sucking the water out of my skin, putting it into circulation to dilute out the excess salt. What happens to your skin when it gets dry?
Dry, itchy, flaky
It gets dry, itchy, flaky. Another place that I have a great storage of water is in your poo. Poo is in fact, the colon's job is to regulate the water. And so if your body is screaming for fluid, oh my God, your colon is going to start sucking that excess water out of your stool. Everything is to get more water into circulation. Well, what happens when your poo becomes dry? Constipation. Hard, dry poo does not pass easily. Your brain has a bunch of water. So if I start sucking the fluid out of your brain, what's going to happen?
Dry up.
It's going to dry up. You're going to end up with seizures. I've now taken all of this fluid from all of these places and thrown it into your circulation. I have increased the overall volume of the blood circulating. What happens to the pressure? It's going to go up. So hypertension, high blood pressure. And then eventually you're going to blow out some sort of blood vessel and die. Yeah, you're going to die. So all of these have to do with how and where is your body getting the fluids to dilute out the salt. Does that make sense to everybody?
How much salt do you have to get to have an excess?
Honestly, it's going to vary. It's going to vary. Now, in animals, obviously, are they eating McDonald's hamburgers 3 times a day and taking in large volumes of salt? No. Where we see sodium chloride excesses is in animals that have some sort of kidney failure, and they're unable to regulate the fluid sodium chloride ratios.
Isn't there like a lot of salt in most of the stuff we eat?
Is there what?
There's like a lot of salt in most of the stuff we eat.
Most of the stuff we eat has a lot of sodium chloride. Absolutely. It's stuff we eat. Oh, heck yeah.
That's why it's a
And
lot of
that's
low
where-
sodium products like tomato
When
sauce.
people have high blood pressure and are at risk for aneurysm and stroke, they have to be put on a salt restricted diet. And it's very difficult to do. It's very difficult because everything has salt in it.
Is that just like a plain diet, like just,
And well, no salt,
so just bland?
No seasonings, nothing.
no seasonings, no nothing.
I would die.
So do I.
Everything.
Or Tony's.
If you take one like a restaurant shakers and just eat all the
A little bit
salt, would it be excess?
Oh, heck yeah.
Okay.
Yeah, if you take a salt shaker, and in fact, your body won't allow you to do that. In fact, interesting little tip, if you have an animal at home that you need to induce vomiting, one of the things, although not commonly done because of the potential for excess, is you give them salt. And the body will go, yup, nope, and throw it up.
That's why when you go swimming
This
in
is
the
also why if you are shipwrecked
ocean.
and you're floating in the ocean, why is it you're water everywhere and not a drop to drink?
Salt water.
It's salt water.
It's gonna be.
It's gonna
And it's going to
dehydrate
dehydrate you faster, even though you're drinking fluids, because now you have increased the sodium and you don't have the fluids to compensate for that, and you're going to die. So, yeah.
Because then that would be excess drinking salt water.
Yeah, you would have an excess sodium chloride from drinking the salt water, which is why you can't, if you're shipwrecked, if you're out in the ocean, you can't drink the water. You have to do what's called a desalinator, which is a thing that will remove the salt from the water before you can drink it. So there you go. There's your tip for if you ever become shipwrecked in,
You can boil it.
Or coconut.
I think tip number
do what?
You can boil it.
You can also boil it and boil off the salt. But if you're on a life raft, like think Life of Pi,
You,
you know, where the guy was on the raft with the tiger. Oh, that was a fabulous movie.
That is
Yeah, I liked it.
I've never seen
Oh
it.
my God, my
It's
best
great.
friend and I watched that and then spent the next 4 hours discussing, because it's not a movie about what you think it is.
With the boy with the tiger.
It's not a movie about a boy and a tiger.
No,
Well,
It's a movie about a boy and his father.
yeah.
but it has the boy and the tiger.
But the entire movie is nothing but an analogy. It's, we deep dived that one. We've had a few burrs.
It was just metaphorically speaking.
All right, so the next one is magnesium, and yes, there's a reason why I have a picture of a Christmas Story up here. Not just because it is my favorite Christmas movie. It is my favorite. I own a leg lamp.
Really?
I do. I have a leg lamp, full-size leg lamp. Christmas is my all-time favorite time of year. I love Christmas. My house, here's a little, I don't know if I'm willing to share this part of my life with you guys. My house is decorated for Christmas all year long.
Nice.
Not in a weird, like I have Christmas lights out on my front.
But
you know,
like
on
keeping
the-
the good happy vibe.
all
Like keeping the vibe in the house.
No, I mean, like I have a ton, and it's not like I have a dead tree in this, you know, needleless tree branch in the corner. No, I have a small, like 2-foot artificial tree. I clean it twice a year. I take all of the ornaments off. I wash the tree because obviously it gets dusty. I dust all of the ornaments. I reassemble the tree. I have just stockings on my fireplace. That's it. But it makes me happy. It does. It makes me happy. And sometimes when you're feeling sad, you know, you're just sitting there in your living room by yourself and you're just feeling sad for no reason. I plug in my Christmas tree and it just makes me happy.
Aw.
I know, because I look at the ornaments.
So that's
All
your
of my
channel.
ornaments have a special meaning to me.
So then that's your channel.
Some of them are ornaments my sisters and I have, you know, given each other, that sort of thing. A Christmas story is just like magnesium. And I'll explain to you what I mean by that here. Magnesium is a component of bone. All right, we had 2 minerals that were the primary constituents, meaning the primary ingredients. What were those 2 minerals? Calcium and phosphorus. Those are the 2 main ingredients of bones. Magnesium is a component. What that means is, can I make bone without magnesium?
Yeah.
Yes. Is it going to have the same integrity?
No.
No. Christmas Story. Or any movie. It doesn't have to be a Christmas Story. You have those movies with your main characters. A Christmas Story, obviously Ralphie is the main character. Has anyone never seen The Christmas Story? I'm gonna
Oh
punch you
my
in the
God.
face
You've
right
never
now.
Movie night.
How the holy heck have you never seen it? It's literally on for 24 hours on Christmas Day.
I don't know.
Classic when Santa pushes him down.
That's not an excuse. That's not an excuse.
Where he licks the pole and his tongue gets
That's the other part I looked at.
Every Canadian child on the planet.
Nothing our face.
Is that where he walks down in the bunny suit?
Where he does what?
Yes,
Walks down in the bunny suit?
Yes.
Oh, okay.
with the big leg lamp.
I watch it.
Yeah, fragile. It must be Italian.
I feel like most of us are busy stuff face more than
You
watching
have
TV.
You have the characters Ralphie. You have the character the dad, right? Those were the main characters of that movie. Could the movie have been made without Dad or Ralphie?
No.
No. But then you have the younger brother, Randy.
Mhm.
Remember the little kid? He's like, you can't put arms down. Every kid in Canada has had a snowsuit like that. Randy was there. He didn't add a whole lot to the story. He was mainly a background character. My question is, could the movie have been made without Randy?
Yes.
Sure. Would it have been the same movie?
No.
No.
No. Bam. Magnesium's role in bone formation. Can I make bone without it? Sure thing. Is it going to have the same integrity? It will not. Does that make sense to everybody? Magnesium is also one of those neuromuscular transmission where a nerve impulse enters the muscle. Remember, nerves are your social distancer part of the body, and I need to have something move across the distance. Something that goes from the nerve to the target area to tell it what to do. I need something to do that because the nerve itself does not touch. Magnesium is one of those neuromuscular transmitters. And then it specifically helps us metabolize carbs and fats. That would be a great question. I can say, which 2 energy-producing nutrients does magnesium help you metabolize? And then list all of the energy-producing nutrients. So this one is specific for carbs and lipids, carbs and fats. So those are the duties of magnesium, Mg. Comments, questions, concerns? Is everybody okay with that movie analogy?
Mhm.
The great movie.
It is.
And yes, every Canadian child on the planet has a snowsuit like this, or had one, and has stuck their tongue to a pole.
My brother got his tongue stuck to a pole when we were younger for so long, and we did not know what to do. We were just like, sorry, because me and my older brother told my younger brother to do it. And then we were like, we're not helping you out on this one. You're on your own.
Yes, I was very young. I was probably in kindergarten at the time, but I have a very vivid memory. And we had stuck it to the pole, and they come with hot water, and they have to pour hot water over your tongue.
Mhm. I mean, I've had that happen with my ice cream, little paletas,
Oh, yeah.
right?
A magnesium deficiency, again,
Yeah. the
just
masculine.
consider what does it do, and then you'll be able to critically think through what happens if I don't have it. Well, if magnesium is a transmitter to tell your muscles what to do from your nerves and you don't have it, your muscles don't get the message. So they don't work. You get muscle weakness. I'm gonna skip over that second one for just a second. Again, neuromuscular transmission. I'm not receiving the correct message, convulsions. Remember, a convulsion, we talked about it yesterday, is an involuntary contraction of a voluntary muscle. Well, the message is getting all screwed up. Imagine trying to tell somebody, everyone in here has had bad cell phone reception. It's so frustrating because you're trying to give the person a verbal message you're talking to, and they're not getting it. And they're hearing you wrong, they're not hearing you, you're cutting in and out. That's magnesium is a cell phone with bad reception, trying to tell your muscle what to do. Deficiency. Anorexia. We're gonna have vomiting, again, because of its impact on the smooth muscle. Muscles are not getting the correct messages. Decreased mineralization. Well, yeah, magnesium is a mineral. It's a component of bone. If I don't have it, I don't have all the minerals that my bones need to be bones. The one emotional symptom of a deficiency, oh my gosh, some of you I think might be magnesium deficient. Hyperirritability.
Doesn't it cause anxiety too?
Yeah, that would be right hand in hand with this hyperirritability. And then your magnesium deficiency causes everyone around you to get anxiety
So then
because you're super hyper irritable and you're just snapping the head off of everybody.
That's what I was doing to you at the hallway.
No, you were not being irritable to me in the hallway. That was not irritability. Here's irritability. So I had, back several years ago, I was on, when I had the West Nile, because I had West Nile.
What haven't you had, by the way?
Oh, there's not
My
a lot
goodness.
that I'm not putting anything out into the universe.
Jeez.
So I had the West Nile, but I got chronic West Nile. Normal people get acute West Nile where you don't even know you've had it. I developed chronic where it took up shop in my kidneys and it caused my immune system to go haywire, and it was a mess. So I was on this medication that caused me to have magnesium deficiencies. And that combined with the medication made me wildly like bipolar irritable. And so, for example, I would be sitting with my dearest, sweetest, why he stayed, I'll never know, significant other. Well, he's a fidgeter. Okay, he's got to be doing something with his hands at all times. Usually, he has these little games that he'll play on his phone. So when we're watching TV and stuff, he's a fidgeter.
Yeah.
And so he would have like a pen, and he'd be just, tapping the pen. And it would just infuriate me to the point where I would just look over at him and go, if you don't stop with that GD pen, I am going to pull it out of your hand and I'm going to stab you in the eye with it. And he would just go, okay. So yeah, hyperirritability. We're not entirely sure why magnesium deficiency is thought because of the nerve transmission. something wire is getting screwed up in the brain, but we're not really sure about the physiology behind that particular symptom. Physiology behind everything else is solid. We can figure that out for ourselves. Calcification of the aorta is also one that's a little bit novel for this particular mineral. Remember, calcification does not mean calcium. It means to mineralize. What is your aorta? It is the largest artery in your body that exits your heart, goes down your entire midline, and every other blood vessel that feeds every cell in your body comes off of it. So your aorta is under a tremendous amount of pressure, and it needs to have elasticity, right? Every time your heart beats, it dilates, and every time your heart relaxes, it contracts. That's your pulse. Now imagine if a tiny bit of your aorta mineralizes. What happens to the elasticity in that part? Gone. But the areas on either side are still elastic, and you're gonna blow it out. Dead before you hit the floor. No, I'm not. This one, I'm not kidding. I have a picture here. So here is, let me move this. So this is where the heart would be, right here. Here's the aortic arch, exiting the heart from the left ventricle. Here are where we have the branches going to the carotid arteries, which feed your head. Is everyone with me? Right here, we've magnified it here. This almost looks like a trachea, doesn't it? Like with those hyaline cartilage rings. This is mineralized. This is no longer elastic. And we've had a blowout right here.
So that's crazy.
And you will bleed out, and you'll be dead before or shortly after you hit the floor.
So,
There's no saving you from aortic rupture.
so magnesium, if you, what is that, excess?
This was deficiency.
Oh, so deficiency could literally kill you.
So deficiency is calcification. Yes.
So basically that's what happened there was it was the calcification of the aorta and it just like,
Yes.
So
So,
it just happened, it's just like,
so when I have one area of that is elastic and still,
yeah.
and then one area that is not, so this area stays still. Do you see how when this dilates, it's gonna pull and it's gonna rupture? Bam. So yeah, you're not coming back. There is no call 911.
There's just see you later.
There is, we'll have a lovely funeral for you. You know.
Funeral home.
Yeah, there is no coming back from aortic rupture. Because it will take,
That makes me weird.
depending on the size of the rupture, it could take anywhere from 10 seconds to 30 seconds for you to bleed out.
Like, do you feel it at all, or you just
I
like?
don't know. I'm not putting that into the universe.
Well, I know, but like,
I don't wanna have an aortic rupture.
you can ask somebody, but like, they're like dead, so.
I've
Like,
never,
do you feel
I
it?
personally have never seen an aortic rupture. I would imagine that it would rupture and it would just be like turning off a light switch.
Like, you're like witnessing it, you're
So
like,
instant.
do you feel
No,
it? And they're just like,
I don't know. I have no idea. I would think that if it caused any pain, it's not gonna be pain that's lasting very long, because in 10 seconds, you're gonna be dead. In less than 3 seconds, you're gonna be completely unconscious.
Like really
So-
literally drop dead.
Yes.
My dad actually passed from an aortic dissection, and
Oh my
it was
goodness.
like, yeah, I was like 6. It's actually gonna be 25 years this month. It's weird, but they woke up. He wanted coffee. His girlfriend left to get him coffee. Went in the kitchen. Came back in the kitchen with the coffee out of the pot that was already made, and he was already passed away. Like, it was that quick. And she didn't hear him say anything. She didn't hear anything. She just walked in and she thought he was asleep again. Like, it was that quick.
Wow, I am so sorry. I did not intend to trigger, but
Oh.
yeah, it's just that quick.
I just want to tell the rest answer that question. Like, it didn't look like he felt anything or anything like that. He just basically went to sleep.
Yeah, and that's what they say. I've never seen one in an animal, thank goodness. But yeah, what I've heard from other stories similar to yours is the person just maybe slumps over and looks like they've fallen back asleep. We did have a family friend whose husband had an aortic rupture in bed, and she had no idea. She woke up the next morning and his alarm was going off, and she's like, "Hey, oh dear." And he went so quietly in the night, she didn't even know.
I woke up next time, that'd be scary.
You all right?
So if you get shot and then like bullet nicks your
I feel
aorta.
so bad. 'Cause I hope she doesn't
Do
get
what?
it.
If you get shot and a bullet like nicks it.
It's the same as a rupture.
Ooh.
So imagine here,
So it's nothing to play with in other
and,
words.
and so the rupture, so the pressure in the aorta, if I took a pin, okay, so let's just say I have the ability to reach my hand into your body. And I have just a pin, a sewing pin, nothing big, no, not a needle, not a knitting needle, just a pin. And I put a pinprick hole. The pressure behind it is going to cause that pinprick hole to just blow out. Fireman's hose. I put a pinprick hole in a fireman's hose, the whole hose is going to disintegrate because of the internal pressure.
Wow.
How deep is your aorta?
Your aorta is deep, deep within your body and it runs down your back.
It's not very superficial, right?
No, it's deep within your body. It's pretty hard to get to.
Nice.
Magnesium excess, we're going to see similar clinical signs to our phosphorus excess. You're going to have the urinary calculi, which remember is the formation of our bladder stones.
So I asked this question in anatomy, and she kind of just like looked at me, trying to figure out what I was trying to ask. We were talking about stones and all that stuff, and I was just like, well, how can it be kind of like prevented? And she like looked at me and she's like, and
So,
I was just like, maybe that's a tough question.
no, it's, and the reason why is you can't. There is no way
I don't.
to prevent it. Now, there are things, so before we know that the animal is predisposed to stones, there's no way.
Mhm.
Once the animal has, okay, this animal now gets bladder stones, what do we do? First thing we need to do is take the stone and have it analyzed. Because we know now there's many different minerals that can cause a bladder stone. That's what a bladder stone is. It is an accumulation of minerals that have joined together to form a stone. You have phosphorus, calcium, magnesium are the three big ones. You have uric acid stones, all kinds, citrate stones, all kinds of stones. First thing I need to do is find out what kind of molecules, what kind of minerals are making up the stone, and then I just regulate those minerals in the diet. I also increase water intake to keep the body flushed. I'm going to decrease, it's called ash, which is not ash from your cigarette. Ash is the term we use for overall minerals. And I'm going to give the animal nutrition to make sure that the environment of the urine is a pH that does not solicit the formation of stones. Some stones form in basic urine, some stones form in acidic urine. So I need to alter the pH to make sure it's not a pH that's going to form the stone.
And I heard that, the pure alkaline water, it's called Essentia, and I was told that if you drink a lot of that, it can actually prevent like cancer, like help kind of prevent cancer, because cancer apparently thrives in acidic environments.
I have no idea. Because that's not a treatment we would use in veterinary medicine. So I have no idea.
Well, why do people drink that type of water?
It tastes good.
I don't know. I don't drink it. I drink Diet Coke.
It tastes really good.
I don't know why.
Don't know. Why do people do the things they do? No idea. I gave up trying to figure that out a long time ago.
Wait, what's it?
So those are the macro minerals. Everything we've just talked about is a macro mineral. Macro minerals, where we're going to see the excess is obviously in the diets. Where you have the excess in the diets. You can also get the excesses from supplementation. We talked about that with like our large and giant breed dogs, trying to get them to grow bigger, throwing the calcium, doing the opposite of what we want it to do. Now, the great thing about our commercial diets is that all of this is measured out for you already. Commercial diets have to be complete and balanced, meaning that they have to contain the nutrients in a form and in an amount that will keep the animal sustained nutritionally. So for the pet foods to be labeled complete and balanced, they have to include all of these macro minerals in the appropriate amounts. So it takes all the guesswork out. Where we really start seeing issues is, again, where people start cooking for their pets. And the mineral content and the ratios start to get out of whack, and we start to see some pretty dramatic health concerns. So we've got to educate our owner. Some of those breeders, oh gosh, they're Google trained. Yeah. They're trained by Google. I'll give you guys a minute. So you finished the urinary system. What are you going into now?
All the glands, right? The hormones.
I love everything about anatomy. Haven't you noticed?
Yes.
Endocrine, you've got your pituitary, your anterior, and your posterior pituitary. One creates 7 hormones. Have you gotten that far?
No, we haven't started it yet.
Oh, yeah.
Yeah, we took our for
Oh, no, I'm talking about endo. So your pituitary, you have your, I believe it's your posterior, but I might be making that up. One of them creates 7 hormones. And these 7 hormones govern everything about your body. Like you have your pituitary creating thyroid stimulating hormone. Well, guess what it does? It stimulates your thyroid.
Does it do one where it helps you grow, though?
Yeah, it's called
Growth.
growth hormone. Yeah, whoever put together the endocrine system was fabulous. You have growth hormone, you have thyroid stimulating hormone, you have melanocyte stimulating hormone, which affects the color of your skin. You have luteinizing hormone, follicle stimulating hormone, which are the 2 that help you ovulate, maintain a baby. So all of these govern every other structure about your body. So it's kind of like you have Mr. Hamilton is the pituitary gland. And Mr. Hamilton is the one that governs the body of the school. He has his directors. I am the director of the program. Ms. Z is the director of career services. Ms. Annie is the director of financial aid. The directors are where he gives his direct orders to. So he'll call me and go, okay, this is what I need to have done. And then I'm the one that then farms it out to the appropriate gland instructor, who then affects change within the student body. That's how the endocrine system works. If Mr. Hamilton doesn't have me, if I was going to say if I died, but I really don't want to put that out in the universe. If I am unavailable and Mr. Hamilton has some message that he needs to send to the instructor to affect change, but I'm the only way he can get a message to the instructors, guess what happens?
It doesn't happen.
It doesn't happen. So if the thyroid stimulating hormone doesn't get produced, can he send a message to the thyroid? No. And then the thyroid doesn't do its job.
And that's how people get medication.
And then we have issues.
That's where I get thyroid disease.
This is just kind of a fun interlude in between our macro and micro minerals, because the next section we're going to be talking about all of our micro minerals. This is just a comparative of unhealthy snacks in our pets. And I find this fascinating. So if you take a 10-pound cat or a 10-pound dog, this is portion control, you guys. This is why 80% of our companion animals are obese. I like potato chips. Poppy and Maisie both like potato chips.
My cat does.
If I give them one single, not a big giant one, just a single average sized potato chips, the calories are the equivalent if I eat half of a Big Mac.
Might as well eat a Big Mac then.
Might as well.
Well, I mean, if I give them the calories in one chip for a 10-pound pet is the same calories I would get if I ate half of a Big Mac.
That's crazy.
1 ounce cube, you know the fancy cheese trays that have the little cubes of cheese?
Yeah.
If I give them one cube for Maisie, that's it, 1 cube, that amount of calories for a 10-pound dog is the same as if I eat 3.5 Big Macs.
Oh my God.
So now I'm gonna be skinny because like all this information you're telling me.
Well, your pet will be.
Oh.
This is for you feeding your pet. A cup of whole milk. Well, we all know dogs and cats are lactose intolerant. You should not be giving them milk anyway.
No.
But a cup of whole milk, look, 1, 2, 3, 4.5 Big Macs.
Ooh.
So when you are cutting the cheese, because I love cheese, and you're eating it and you're giving your dog, oh, here, have a little bit more, here, have a little bit more. Suddenly you realize over the course of just a few minutes, you've given them enough calories to equivalent like 10 Big Macs. And we wonder why we are having fat pets.
I gave my dog a carrot and he's looking at me like I'm the
What
worst
I'm
person in
saying,
the world.
you should do a comparison to those potato trees.
For the what?
The